Whether you're an OG nurse or a new grad, these are 5 nursing no-nos. This first one is pretty basic. Wash your hands. Your patients are watching you. Your families are watching you. This is just nasty. Wash your hands. Use the hand sanitizer. Use it per your company policy. Sometimes just using that hand sanitizer all day, it just makes your hands all nasty. So give it a good wash. Do not chart something that you did not do. How are those lung sounds clear when you do not have a stethoscope? It is fraud. You can lose your license. It's a very bad habit. Very bad habit to start. Do not chart something you did not do. Number 3, I think actually this is probably the most important one. Never assume. If you are confused about an order, don't assume, clarify it. If you're pulling several of the same medications, that is not normal. I would stop what you're doing, clarify with the doctor, because this could save someone's life. Number 4, I know, you're gonna be hearing this in your sleep. And that's all the alarms. Sometimes I feel like we should have a game show where the nurses come on the show and can hear different alarms and be like, oh, that's a bad alarm. Oh, that means the pump's finished. Oh, that means it's occluded. Oh, that's the BiPAP. You know, after a while, you're going to know what all these sounds are, especially telly. It's going to drive you wild. But do not ignore the alarms. There is such thing as alarm fatigue. You know, you hear the telly alarm going, you just hit silence. You're not even looking at why it's alarming. There's a reason why those alarms are in place. Respond, assess, and act. You don't know how many times I've walked into a room where the IV pump is beeping and I walk in, this poor patient, they don't have the call light next to them, or maybe their side rail's down. I've intervened with some kind of safety issue. So please, do not ignore the alarms. Number 5, very important as well. These are all pretty important. It was hard for me to break them down to 5. Work through burnout by yourself. Even just last week, I texted my friend doing my shift. I was like, oh, I'm having a shitty shift right now. Just really shitty. And she was like, what's wrong? And I was like, can I call you in a little bit? I don't even have time to call you right now. Once I had some time, I called her, and just talking about it made me feel so much better. Even if it's just me being petty and whiny. Most importantly, you have to reach out to someone. You can't keep that inside. Nursing is not only tough physically, it's tough emotionally. I would have to say that's probably the hardest part of it, because you're dealing with patients and their emotions. They are sick. Most of them don't want to be there. And sometimes they take it out on you. Those are my top 5 nursing no-nos. Never skip hand hygiene. Number 2, do not chart something that you did not do. Number 3, never assume, clarify orders. No matter how minute and small and stupid you may think it is, clarify it. Number 4, do not ignore alarms. Number 5, do not work through your burnout. A better you means a better nurse. All right, newbies, those were my top 5 nursing no-nos. Did any of them surprise you? Hello, if you've experienced or witnessed any of these nursing no-nos, or if you have any of your own nursing no-nos that you'd like to add down from there. Like, talk shit, send me to your group chat. Yeah, I know. Send me to your group chat. I'm going to go to the vacation too. We're all going to go together. And I thank you so much, so very, very much for taking the time to support the Newbie Nurse. And remember, treat people how you want to be treated, because what you put out in this world is what you're going to get back. Have a great shift. Thank you, God, for this moment. Thank you for allowing me this time to share with others. And hopefully this will help someone in need.